So I'll just kick it off. For those of us joining, my name is Rakhi Vyas. I'm one of the pelvic pain physiatrists in the Englewood, New Jersey and Florham Park, New Jersey offices, and we are seeing men and women with pelvic floor dysfunction and pain. And today we have Dr. Katherine Pace, and so you can go ahead and introduce yourself to everyone.
Hi everyone, I'm Dr. Katherine Pace. I'm owner of Haven Pelvic Physical Therapy out in Westfield, New Jersey, and we see men and women with pelvic floor issues, but we have a really big postpartum population, so I think that's what we're going to concentrate on a little bit today.
Yeah, I think it's a great conversation for us to have, from both perspectives. And so I think one thing that is really interesting, I think people like to know is, how is a pelvic floor physical therapist different than like a general physical therapist?
That is such a good question. We believe at Haven that every patient should be evaluated and treated one-on-one for an hour, and you're not in a huge gym. So a lot of times if you're doing like general physical therapy, like for your knee or for your back, you're out in an open gym doing exercises in a gym. And pelvic floor therapy is a bit more intimate, as you can imagine. So everything is, in a private room. And pelvic floor therapists are able to assess muscles internally. So we have like specialty education to do that.
Yeah, I think that's always interesting. Patients always ask me like, how is that different? And I always say like, well, there's also that component of internal work when you're ready and it's appropriate for you. So I think that that's a big difference, and that, you guys are trained with a lot more courses and things like that to treat
Right.
pelvic floor muscles and,
Right.
also.
Well, I've been doing this for a while, and still every week I'll be like, you do what? And you're going to assess what? Yeah, they're just muscles. So
I
it's
know.
really
Yeah.
funny.
I always tell people it's the best way to get to them, right? Like they're
Yeah.
internal muscles, and I think that we're lucky we're able to get to them this way. So, it's the most effective way, I think, for therapy there. So
Yeah.
that's great. So you mentioned, right, like you are seeing a large postpartum population. So how are your patients like typically presenting to you? And then I can, talk about how I've been seeing them as well.
Yeah, we get most of our patients calling in because they just don't feel right after maybe their 6-week checkup with their doctor, and the doctor says, okay, you're cleared to do X, Y, and Z. Go ahead, run a marathon again. And sometimes the women are like, well, I just don't feel right, and they're just not putting up with the answer that, well, this is normal. It's just going to take some time. And so they go on Google or Instagram and they find us. And so we get a lot of patients that have ongoing pain after giving birth, or they feel really weak, and sometimes they just can't put their finger on it, but they know they feel off. And so they come and they see us.
Yeah, definitely. And so similarly, that's how a lot of patients are presenting to our office. And I think, there's such a wide variety of ways patients can present postpartum because there's so much going on in the pelvis in general. So, you can have patients who have, just one symptom or 3 symptoms or 5 symptoms. And so, we're seeing a lot of urinary symptoms, a lot of patients with, urinary urgency, or frequency, or leakage. And, like you mentioned, people say like, oh, that's just kind of, the normal. You're just have urinary leakage when you cough or sneeze, which, as you know, too, it's not normal.
Right.
And so we're seeing a lot of patients present with those symptoms, a lot of pain as well, pain with sitting or tailbone pain, or pain with intercourse, right? Like you said, after they have their OB evaluation, sometimes they're cleared for intercourse, but it may not be, pain-free. And so that's, a big symptom that we're seeing as well.
Right.
And then, issues with bowels, sometimes, oftentimes it's, constipation or straining. And I think, when we're talking to the patient, learning about their, birthing history too gives us a lot of information about maybe what symptoms they have. Sometimes they have, vacuums used or forceps used with vaginal deliveries.
Yeah.
Or like an episiotomy or, tearing. And so those can also kind of, be something to consider when we're, evaluating these patients.
Yeah.
That's definitely, I think that's why it's always so interesting. Like one patient who's postpartum, 8 weeks can present so differently from another patient 8 weeks postpartum.
Right. And it can be the same patient on pregnancy 1, pregnancy 2, pregnancy 3. It's not always, oh, it gets easier after each time you have it, which I've heard, or it gets harder. It's kind of like, sometimes it feels like there's no rhyme or reason. There usually is some kind of reason behind it, but to the patient, it feels like, well, I did so great with pregnancy number 1. Why is pregnancy number 2 so hard? Or, something like that. Yeah.
Yeah, sure. And I find a lot of patients also like, presenting after multiple children, like, well, I just didn't have time to kind of, digest this in between. And now having these symptoms ongoing kind of through the different pregnancies as well. So,
yeah. And that just reminds me, like something that I hear a lot from my moms is that they want to get better after their baby because they want to feel good enough to try and have another baby, or they suddenly feel, maybe not insecure is the right word, but they feel like they were relying on their bodies and their body was just performing so well to do whatever task they wanted to do. And then sometimes after having a baby, it just feels really different and they feel like they can't rely on their body as much, and they want to have that confidence again before they go ahead and try to have another, baby.
Yeah, I think that's amazing, right? Just like almost like prehab, like how you like ortho, right? Like when
right.
gonna go in for a knee surgery or back surgery, we're already telling them like do physical therapy before to kind of prepare your body. So I think it's like wonderful that people are even thinking about it that way. Kind of, it is a large transition. Your body's going through a lot of changes over 9 months, and then the delivery itself is kind of a big
traumatic. The
body goes through a lot in a short period of time. So that's great that some of your moms are already cognizant of that. So that's great. So let's see. I know we had questions already pop up, so I'm just seeing. Here's one. Is the internal exam different from the one I get at my gyne? You can go ahead, first.
Yes, so it's going to be a little bit different. It's both going to be internal, obviously, but a pelvic floor therapist is looking for very different things. So usually your gynecologist, they're going to do your annual, they do a pap smear, they try to collect some culture. We're not doing any of that. We're really assessing for spasm. We're looking for what the tissue feels like internally. So if you've ever been to physical therapy before, they assess what your back feels like, what your, quads, your hamstrings feel like. And that's exactly what we're doing with your abdomen and your pelvic floor. We want to see whether there's spasm, there's trigger points, if it's strong, if you can contract the pelvic floor on command or can you relax on command. So those are the kinds of things that we're looking for versus what a gynecologist is looking for. That's a great question.
Yeah, I agree with, everything that obviously.
Yeah.
So yeah, I think, some patients do think that, or they ask me like, are you going to use a speculum? And so
Mm.
always something where I'm like, no, we're not opening up with the speculum. We're usually using our hands. And so it is a bit different in that way. Let's see here. And so what about, well, like, what is your approach when you're kind of like going for your treatment towards like your postpartum moms? Where are you generally like starting with them? And,
Yeah.
yeah.
I always start with assessing like breathing, like just the super easy things that you don't really think about. So how are you breathing? There's such a huge correlation between what your diaphragm and what your pelvic floor should be doing. I'm sure you realize. And if you have tightness or stiffness or pain, that alters what your pelvic floor is doing. And sometimes a lot of people breathe into their chest and not into their pelvic floor. So they're creating even more an environment that will make your pelvic floor even tighter than it should be, which kind of just, it goes through a vicious kind of cycle. I'm sorry, I was just reading a comment. I already had pelvic floor spasms, been through PT and endo. If my spastic, would postpartum worsen this if I get pregnant? I really, that's really hard to like answer through through Instagram. There are times that I find that just anecdotally, patients will say, oh, I had this issue and then I got pregnant and then it went away. So anecdotally, you just never know. But I think it's always, taking a stab in the dark or guessing is never good medical advice. And so I would really advise you to like seek someone in your area so that you can figure that out. Yeah.
I think it's always like difficult to know how someone's going to react to anything,
Yeah.
But I think like being aware of it, for the patient or, watcher that asked that question, like being aware of that is already, you're like, I think a little bit ahead of
Right.
people that don't even recognize that. So knowing that already, maybe, starting to do some breathing exercises, things like that, that's definitely like hopefully going to put you at a better place postpartum.
Yeah. Yeah. So yeah, usually I will start with just assessing like how they're breathing. And then sometimes people feel scared to do pelvic floor therapy. Like they're scared that they're going to injure something because they're only 6 weeks postpartum. And I'm always like, moms, like straight out of the hospital, you guys are doing way more than anything we would ever do visit one. Like you're carrying that baby, you're lifting, you're cooking, you're doing laundry. I mean, for most of new moms, they're already doing this within the first week.
Mm-hmm.
So anything that we're doing in pelvic floor therapy is going to be super gentle compared to what, most moms are already doing.
Yeah.
Yeah. What do you think about that?
Yeah, I agree. And I think I wanted to go back to the breathing thing you were saying because it's so important, right? And I've had a lot of patients who come back after they started physical therapy and they're like, oh my gosh, I never even recognized that I was breathing. So like, with no like motion. And wow, I have so much to work on. And something as simple as that is, can make such a big difference. And that awareness, like mind-body connection, sometimes their pelvic floor is just like tight and stagnant and nothing is happening. And when you start thing, you're like, getting that full excursion, it makes such a difference for them. So I think that like, a huge part of PT. And I think that patients don't really know it until they're kind of in it. That's definitely, important. And so, just like, we are doing full evaluations on our patients as well, really talking about all these symptoms to kind of try to connect them together, the urinary symptoms, the sexual symptoms, the bowel symptoms, the pain, kind kind of, also talking to patients about their goals and where they want to, what they want to work on, where they want to get to, if they were running before, okay, that's a long-term goal too, right, for all of us. So I think that's important. And then, doing a full like musculoskeletal evaluation, assessing the low back, the hips along with the pelvic floor, the core.
Yeah.
So you're seeing a lot of diastasis rectus as
Yeah.
well.
Yeah.
So that, another huge component when we're talking about kind of all these muscles and how they're so connected, the pelvic floor, the diaphragm, the core, the back, right? There's just so much that is interconnected and works together. And I think it's very interesting with, patients postpartum that, like you said, they're doing all these things already. They're cooking, they're cleaning, they're carrying their child. So they're already kind of forming these compensations with other
Mm-hmm.
because everything's working together. And so that's where I find like physical therapy can be so important because the patients can learn how to properly use all of these
Yeah.
muscles,
And I just think that it's so great that you as a physician is like, you're saying all these things, because sometimes patients will come to me without a physician referral and they get scared. If we try all the things in physical therapy, and I'm like, well, we're just not quite, you need a little bit more, I feel like. And then we'll say, okay, check out Dr. Vyas. And they're like, well, I had such a bad experience with doctors, they, and I'm like, you really need to find a specialist in your field. I really cannot reiterate that enough with my pelvic floor patients, that you really should not be going to just a generalist when it's something so specific. And so that's why, just like I wouldn't advise someone with a pelvic floor issue to go to a generalist physical therapist, I would not tell them to go to a generalist physician and be like, go here.
Yeah.
This is their name says it all. It's pelvic rehabilitation. So I think it's great that you're saying all those things.
Yeah, no, that's our specialty. That's what we're seeing day in and day out. And so it's important to us that we're thorough too with our evaluations. These patients are coming to us with these symptoms, and we know kind of how interconnected all of this can be. So talking to them about all of it is really important to us too.
Yeah.
And then, along with PT, talking to patients about potential like medication management, depending on where they are in their journey, with a lot of postpartum patients, if they're breastfeeding, we don't want to add anything, that would be harmful. But, if there's something that is needed, we can always add oral medications, or sometimes we add medications in the form of suppositories as well, to really just treat those local muscles and nerves. And then sometimes for, our chronic pain patients, or, just chronic symptoms that are ongoing, which, is basically like 6 months or more. So that's not that much time, right, to diagnose chronic within 6 months. So, we're evaluating these patients, and sometimes, we are doing an injection series of nerve blocks and hydrodissections along with trigger point injections. So that is something that, based on our patient evaluation, we're determining, hey, like, what does this patient need, and how can we treat them and figure out an overall plan for them. And I think that's always, my goal, seeing any patient, and obviously postpartum patients as well. So all of those components together, like we say we love a multimodal approach. Everything works great together.
Right.
And I think another big thing, a lot of my patients as well, I refer them for like cognitive behavioral therapy, just because, it's a large transition already being postpartum. And then, like you said, your body is changing, you're not able to rely on your body the same. Maybe you have, you're having painful intercourse that's affecting your relationship. There's just so much going on, right? And that brain pain, just connection is so strong that I think that that's also a really big resource, I think, that we have for our patients.
Yeah. I remember telling you when we were talking about that before, I think that is amazing. And I think new moms don't ever, they really rarely get the support that they need, you know, and it's not just physical support. It's like that emotional support. It's even having just a community of moms saying, hey, I understand. Like, I get it.
Yeah.
I think that's great that you're doing that.
Yeah, no, that's great. And as someone just mentioned, like, it's great to have a support team. And I think that that's like what our goal is, right? Together, like as a physician and a physical therapist, like our goal is to be a support team to make that team
Right.
our patient. And
Right.
like whether that includes like other referrals, right? Like your OB, your
Mm-hmm.
urologist, whatever that may be, you know, all patients I think deserve having like a team of people behind them to get them where they need to be, and especially in that postpartum phase. So I think
Yeah.
that's great.
Yeah.
Looking at some other questions. I know we had some questions come in before.
Yeah. I think a good question that I think came in from your poll on Instagram was, how long after birth should I wait to start treatment? For pelvic floor therapy, we usually say 6 to 8 weeks postpartum is when most of our moms start, but we've had moms start at 2 weeks, at 3 weeks, because if you're in a lot of pain, whether it's tailbone pain, incisional pain, you can always, we can always do pain management stuff in physical therapy and pelvic floor therapy to try and address that. We don't have to do anything internal. We wouldn't, because obviously you weren't cleared by your OB. But just like, again, going back to the breathing, going back to like just how you're carrying your baby, how are you sitting all day? Is that just reinforcing these symptoms that you're having? It can be really beneficial to start even earlier than getting cleared. And we obviously wouldn't do anything that your OB wouldn't want us to do.
Yeah. No, yeah, that's so true. Like, you know, just mentioning that again, going back to that breathing, that there's so much benefit in doing that early on, right? Or just being aware of that can make a difference before you even get to that internal portion. So I think it's important for our patients to know that, you know, there are other, you know, options before doing the internal work. So yeah. Let's see what else was there. There was someone said, I have something about anterior. Yeah, I have an anterior pelvic tilt. Should I be worried about my future? That was interesting, because that's like, well, it's great that someone's aware of that, right? And again, that kind of can occur from that imbalance of muscles, of all of those, you know, muscles we were talking about that are so connected, your core, your low back, you know, your pelvic floor. So being aware of that is great, and like, you know, being proactive with that prior to getting pregnant, or if you are pregnant, you know, already being conscious of that, and maybe, you know, doing more stretches for your like hip flexors, or working on gluteal strengthening. There's so many things that you can do if you're proactive, right? And so I think it's also great that patients are
thinking about it. Yeah.
It makes
I also think it's kind of like a buzzword now, or like a buzz term, where people might be like, oh, I have an anterior pelvic tilt, like that's so wrong, you know. And sometimes I just don't want to scare people into thinking, oh my gosh, you have an anterior pelvic tilt, you need to come to therapy or else X, Y, or Z. You know, when you get pregnant and you have now this your posture changes, you will automatically start to go into that anterior pelvic tilt. You just can't help it. Like, your body is just going to do that. And there's ways to correct that, but it's not, you know, it's not the end of the world unless it's causing you a lot of pain. Sometimes, people just sometimes hear that and they get worried or they get scared because, you know, a lot of people are talking about it. But you shouldn't be worried about the future of your health. I think that if you do some corrective exercises, you're gonna be okay. Yeah.
When you said buzzword, it reminded me of Kegels.
Oh, yeah.
Like, I feel like that's a big buzzword we always hear too. And so that's similarly another thing where it's like people think, okay, that's what I have to do. Or even before having a baby, people are like, Kegels, Kegels, Kegels.
Yeah.
That helps. I always, mention like that's not always indicated. There's a place for it. And, I think the best way to go for anyone is always an evaluation, because you never want to do something that's not appropriate for you, because you don't really know what's going on, right? Because pelvic floor is internal, you can't see it.
Right.
You can't know if this is the right thing for you to do or not, but it's always interesting, everyone's on the Kegels.
Yeah, and a Kegel really just actually is a voluntary contraction of your pelvic floor. It's one thing that might be appropriate for you. It's really not the end all be all of anything, really.
I know. Okay, what other questions did we get? I don't know if anyone's saying. Happy to hear you mention hydrodissection. What percentage of patients get better with hydrodissection for nerve pain? So, it is, I think, dependent, again, on an evaluation. It's hard to give a number. If someone is appropriate for our injection protocol, then, we definitely would discuss that with them. But yeah, we've had some papers that have shown, and research that has shown that about like 85% of our patients are getting better, at least 50% decrease in pain. So that is, what we've been seeing. But again, everyone is different. So it's something that, based on your history and physical examination, we can kind of determine what we think is appropriate for you and which nerves and muscles to really target. So that's always but great to have in our toolbox, though. And then one we had before, curious how to handle back pain from a weak pelvic floor. Oh, I think that Katherine is frozen. So that's a good question, right? The back pain with a weak pelvic floor. So again, I think that's a lot of our muscles being very connected. Uh-oh, we lost her. And so I think it's important, again, to get evaluated, right? Because it may be low back weakness. It may be, did I accept her again? Oh, yeah.
I'm sorry about that.
You are. No, that's okay.
Swiped you down because I was trying to read the comments.
I know, technology, right?
So bad at it. I think you were talking about the back pain?
Yeah, I mentioned there was a question that said, curious how to handle back pain from a weak pelvic floor.
So if you have chronic back pain, there is, I think the statistic is 90% chance that you have some pelvic floor dysfunction going on. So they usually go hand in hand, just because anatomically your body does not work in isolation. So there is no one way to handle back pain from a weak pelvic floor. I guess an obvious answer would be to strengthen your pelvic floor, right? But strengthening your pelvic floor, again, is not just Kegels. It's actually a lot of things it's a lot of coordination, because just like the pelvic floor, your abdominal muscles, your low back. So again, there's no like one or two exercises that'll cure that. You need a really good evaluation to see what's really making your pelvic floor appear weak.
Yeah, I've had some patients that they have low back pain, and this is postpartum and kind of, even otherwise, but they have low back pain. They've done physical therapy for their low back, and they kind of hit that plateau. And that's when I've had some patients come in and say, my physical therapist said, maybe this is, my pelvic floor, because we all the things we're supposed to be doing, but I'm
Right.
not getting better. And that's when I think, then once they have that introduction of, pelvic floor physical therapy and kind of, if we medication management or things like that, we are able to kind of get them better. So
Yeah.
that's, like you said, everything goes hand in hand. Nothing is working in isolation. And so treatment also is never in isolation.
Yeah.
Right? Like we're not
Right.
just looking at the pelvic floor, we're looking at that low back, those hips, that core
Absolutely.
thing together.
Absolutely.
So yeah, that's always interesting. Someone mentioned, do you ever recommend using a wand for pelvic floor pain?
I recommend using a wand a lot. I think it's a great home exercise tool that you can use at home. I do think that it's beneficial to come in so that we can teach you what to do, or otherwise I feel like you're kind of like in a cave. You don't know what's going on. You don't know where to press or what to do. But yes, I recommend using a wand a lot to patients with pelvic floor pain.
Yeah, I think it's a great way to have them like involved in their care, part of their home exercise program. But like you mentioned, yeah, I always, advise a patient to learn how to use it with their PT first so that they are targeting the right areas and not doing anything that's, harmful to them. Because that's the last thing you need is for you to be using a wand and cause a flare, right? So everything is good when used properly.
There you go. And I like them better than dilators for sure, because sometimes I'll get patients who are like, well, my doctor said to use dilators, and then they're like, it's not helping, and I'm like, okay. And sometimes the wand's a little better because you can actually get to specific muscles. So
Yeah, I think they're both so different. So it's always good to, I think when you're really trying to treat those muscles or get to that tension, the wand is, I think, more beneficial. And when you're really to work on, that tolerance of the penetration, real
right, yeah.
the dilators can be super helpful as well. So, yeah. So, I mean, this was great. Any like last minute like tidbits you wanted to add?
I just wanted to say it is our mission. It was my mission, my personal mission, to get everyone to know what the pelvic floor is, men and women and children. And I really feel like in the United States, we can really be better at supporting our postpartum moms. Like in France, they automatically get pelvic floor therapy after having a baby. And I feel like that should be happening here as well. So
Absolutely.
yeah, that's my last little last little thing to tell you.
Yeah, and tell us, where can we find you? Like, how can our patients
So obviously I'm on Instagram at Pelvic Haven, or you can Google us. We're in Westfield, and you can email us at info@havenpelvic.com if you have any questions or you wanted to schedule an appointment.
Great, yeah. And for me, yeah, you can, our Instagram is at Pelvic Rehabilitation, or our website is pelvicrehabilitation.com. And like I mentioned at the beginning, I'm seeing patients in the Englewood and Florham Park offices in New Jersey. But if you are not from New Jersey, we have offices in a lot of major cities. So, once you go on the website, there's, we have a lot of providers out there. So thank you guys all for joining. This was really wonderful.
Thank you.
Do it, Katherine.
It was so nice to talk to you again, Dr.
Pace. Yeah, and I'm sure we'll be in touch soon.
Bye.
Bye, everyone. Thanks for joining.